Welcome to our Dr. U website. We are the three people who have put together Dr. U, and this is John Ballou. I'm Cindy Pearl.
Hi.
And we are the non-essentials. The essential person is Dr. Noah. We base what we do on his wisdom and direction, and he is generously passing along the things that he has learned and the things that he knows to us and through us to all of you. And Dr. Noah, we'd really like to thank you for just the time that you've invested and your care for people and your willingness to put this together.
Well, I would just like to say is that we work as a team. Is that even though I have all this information, without John and Cindy with their particular type of special uniqueness, this wouldn't be, once again, revealed or wouldn't be expressed. So, I mean, I really feel blessed and very honored to be working with you two to be able to have this information and share. Once again, this knowledge up here is just, just for me and my patients. You two have now brought it out into the internet, and so that everybody can be able to have access to it.
We're actually a couple of patients that
yes.
that had a few other skills.
Yeah, that's right. And so I mean, I think it's really exciting, and I really thank you for thanking me. But I mean, I want to thank you too in terms of being able to provide this information to the world at large there.
Well, we know that people are struggling right now with concerns about increase in costs of health care. And not only that, but actually increase in the effectiveness of healthcare. Can you speak a little bit to the dangers?
I mean, we're spending over $2.3 trillion a year. That goes out to about $10,000 to $15,000 per person in terms of cost. That we're really not getting our bang for our buck. We in the United States we're last in terms of preventive healthcare. We're last in mortality, and so these are real big concerns. The number one reason for bankruptcy, 60% of bankruptcies are due to medical type of procedures, because these things are so expensive. I talk about the example, this was a number of years ago, I had a patient that had a splinter, went to the ER room, $1,300.
Oh,
I mean, it's kind of crazy. And then we talk about the effectiveness in terms of these things. We talk about that it just doesn't work. We talk about a knee type of procedure. Now there's 2 double-blind placebo studies showing that it's worthless. It's $5,000 a pop. It's still happening $5 billion a year. We talk about medication that's like SSRIs that have marginal type of benefit. I mean, that's not what I say. That's what the science says. These are very expensive things. These are not having the benefit. What other industry can go along? Like if you went to have your brakes fixed at your auto mechanic, and he or she only fixed your car 5–10% of the time, I mean, they'd be thrown in jail. They wouldn't be in business. That's where we're at. And so we're providing with Dr. U to empower your capability of finding other type of sources. Even with people with insurance and not going like that, co-pays have gone up from like $5 or $6 to $30 a copay. Now they have people. It's not uncommon to see $5,000 deductibles. You have to spend $5,000 before your insurance kicks in. I mean, the madness just keeps going on and on in terms of what you get and what in terms of what you benefit from.
Well, there are some serious risks, aren't there?
Oh,
inherent in
as we talked about, the Health and Human Services. That's a government agency, and that's not what I say. One person dies every 3 minutes because of medical procedures.
Wait, one person every 3 minutes
dies. We talked about taking non-steroidal anti-inflammatories, which is like Motrin, Tylenol, Aspirin, people like candy. That kills more people than AIDS does. But people never hear that. They never think about it. That's what's devastating out there.
I did know that when I first came to see.
Well, that's good. Yeah. But that's, once again, that's what, and I thank you two to allow me to have the media to be able to share this information, because, yeah, there are other sources out there, but this is another source to be able to tell people this is what the facts are. You take these things, there are bad consequences occurring. You don't have the money, or hopefully you don't have the health to be able to have these experiments done on you to where you, once again, go down a road where you don't want to go.
And the other thing I like about what you put forward is that it's all backed with scientific study.
Right.
Because I was looking around before I ran into you, and there's all kinds of alternative people out there offering anything and everything. But the thing I noticed about you is that you would put scientific data behind every single thing you handed to me.
Well, that's a myth out there, and I hear that almost on a daily basis. Well, my drug doctor says, he or she would consider alternative or natural medicine, but there's no science. Well, in fact, there's actually more science, because then I just bring them back to them. Okay, you ask your drug doctor, where's the science? And there's a kind of a three-tier type of science. First party is where, the drug companies do a study. That's, once again, very biased. I mean, that's conflict of interest. Second party is where the drug companies then spend and go to another outside source. A little bit better, but once again, we know that that has been shown to have conflict of interest. The university, once again, wants to keep getting paid by the drug companies. And the third party, which is the hardest, is where the university or other type of research just takes the drug or the product and does that. And so that's the challenges that people have, is that they think they can take these drugs and they're scientific. No, it's an info commercial, and that's what we see, like with Vioxx. Vioxx, that one drug killed more people than the whole Vietnam soldiers who died in that conflict and war like that. But you never hear that, costing, once again, tens and $30 billion a year for this pain type of medication. So I mean, that's the struggle out there, is that, and I know that Cindy and Don, and I know John's been on it, has another website in terms of trying to provide information about freedom and liberty. We don't have freedom and liberty in terms of, especially, the information we get. It's all biased. It's all, once again, has a financial type of a reward for it. Here's some BS. Here, take this stuff. Everybody makes lots of money, and you're the poor soul that either suffers from it. So that's just the situation that's out there.
I think what we're offering here is rational scientific studies on lots of different compounds with your advice over the years. How long have you been in practice?
28 years, yeah.
28 years
I turned 25
you're
this
only
year.
30.
Exactly. I don't know how that works.
So you're getting 28 years worth of research into all kinds of, you have a number of different diplomas on the wall.
Well, right. And so what we're trying to bring back is, when I grew up, no one had health insurance or sick insurance. I had a grandmother who, once again, they didn't send people to the hospital or because you had a splinter or you felt you had a fever like that. We're bringing you back to those days where you empower yourself with some simple type of things that you can do. At our website, we have, little places where, yes, you need to go to the hospital if this happens. But, 95% of the time that doesn't have to be. And so we're giving the resources. So we have grandmas. We have, John's really an expert in ancient wisdom with Native American type of cultures like that. Those people knew back then what we know now, but now we just have science to support it. So when, on the plains, when the Indians get sick, they didn't have hospitals. They used different herbs and stuff like that and different type of ceremonies to help them. Now we know that that has a part to play in good health and well-being. Now I'm just able to now cite some science that these ancient wisdom knew for thousands of years. Same with Chinese botanical medicine. Been around for 7,000 to 8,000. Same with Ayurvedic medicine. These are systems that have evolved over time. Once again, 7,000 to 8,000 years, and now we have the science to support. So, well, that's the reason why these herbs work, because they had these chemicals in them. Well, these ancient wisdom 7,000 years ago knew that from other type of means of understanding through trial and error or other type of
thousands of years of trial and error.
Trial and error, which is the best type of thing. And so that's what we're providing you, just simple type of things that can help you and your family, both financially and health-wise.
Yeah. Sure. Common sense, practical, natural alternatives that are proven scientifically to work.
That's what we're offering.
Welcome to Dr. U.
Welcome. Thanks.